Thank you, Mr. President. We have a particularly difficult problem of an exacerbation of a health disparity. We've known literally forever that diseases like diabetes, hypertension, obesity, and asthma are disproportionately afflicting the minority populations, particularly the African Americans. Unfortunately, when you look at the predisposing conditions that lead to a bad outcome with coronavirus, the things that get people into ICUs, that require intubation and often lead to death, they are just those very comorbidities that are unfortunately disproportionately prevalent in the African American population. So we're very concerned about that. It's very sad. It's nothing we can do about it right now except to try and give them the best possible care to avoid those complications.
We now have a code for coronavirus, so we can actually stratify by demographic information, so we can look at race as a factor. We can also look at what the underlying health issues are as well. So we'll be providing that data very shortly, but we will be doing that analysis.
We're working on that very hard. This is something that's come up over the last, I hadn't heard this, and then over the last few days, this has come up more and more. And I don't mean by a little bit. I mean many times. It's a real thing. Now, we want to find cures. We want to find therapeutics. We want to find vaccines because that will solve everybody's problem. But why is it that the African American community is so much, numerous times more than everybody else? And we want to find the reason to it. And Dr. Fauci, Seema, both of them, and others are working on this. And they're going to have very good, I would say over the next, in less than a week, I think you're going to have very good statistics. Couple of days.
Something specifically aimed at those communities that are being hard hit, those black communities.
Well,
that
we're
are being
helping
hard
them
hit.
a lot. But what's happening is we're trying to find out why is it that it's 3 and 4 times. Now, maybe that's not going to be the final number, but why is it 3 or 4 times more so for the black community as opposed to other people? It doesn't make sense, and I don't like it. And we're going to have statistics over the next probably 2 to 3 days, okay?
I just want to make a brief comment to get back to the discussion about the health disparities in the African American community, because it really is very important. And the reason I want to bring it up, because I couldn't help sitting there reflecting about sometimes when you're in the middle of a crisis like we are now with the coronavirus, it really does have ultimately shine a very bright light on some of the real weaknesses and foibles in our society. And as some of you know, the greater proportion of my professional career has been defined by HIV/AIDS. And if you go back then, during that period of time when there was extraordinary stigma, particularly against the gay community, and it was only when the world realized how the gay community responded to this outbreak with incredible courage and dignity and strength and activism, that I think that really changed some of the stigma against the gay community, very much so. I see a similarity here because health disparities have always existed for the African American community. But here again, with the crisis, how it's shining a bright light on how unacceptable that is. Because yet again, when you have a situation like the coronavirus, they are suffering disproportionately. As Dr. Berg said correctly, it's not that they're getting infected more often, it's that when they do get infected, their underlying medical conditions, the diabetes, the hypertension, the obesity, the asthma, those are the kind of things that wind them up in the ICU and ultimately give them a higher death rate. So when all this is over, and as we've said, it will end, we will get over coronavirus, but there will still be health disparities, which we really do need to address in the African American community. Thanks.
Well said. Questions for our